Hello, this is Dr. X, a doctor working here today. May I confirm your name and age, please?
Hello, doctor. Nice to meet you. My name is Emma. I'm 75 years.
Okay, how may I address you?
Please call me Emma.
Okay, Emma, during our conversation, we will actually talk about your health issues today. Is that okay?
Okay, doctor.
And during our conversation, I might take down some notes, which will be strictly confidential. Is it all right?
Okay, doctor. No problem.
Okay. Can you please tell me in your own terms, own words, what has brought you here today?
Actually, doctor, this is not a new thing. That is, I am suffering from it for last 1 year. But I sometimes feel that my heart is beating faster than normal, and sometimes it is somewhat that it runs for a while and stop, and then runs for a while, then stop like this. Something bizarre pattern. I cannot explain it.
Okay.
That was lasting for few seconds, and nowadays it is sometimes persist for hour or longer. And also with these symptoms, that I have noticed that when it persists for a long time, especially for hour or longer, I notice that I feel a little bit shortness of breath, and that usually is something worrying for me, as I have a heart attack about 1 year back, and at that time I also had shortness of breath. So I am worried that is it again another heart attack or just a minor heart attack.
Okay. Okay. Okay, we will. We are very sorry. I'm very sorry to hear, and I will try my level best to find out what's causing you these problems. Well, you told that your problem started around 1 year back. Well, can you please tell me that you also told that you had a heart attack? These heartbeats, were it present before the heart attack or after the heart attack? Can you please tell
After
me?
the heart attack, doctor.
After the heart attack. Okay. Can you please tell me that did it come all on a sudden or gradually?
It was gradually. It was not something serious in initially.
Okay. And can you please tell me that is it regular or irregular? You told that it goes on for
Irregular, doctor.
some time then stop. Okay, irregular. Okay, okay, that's all right. And can you please tell me that you told that now it continues for around hours? Can you please tell me for when from when you notice that it continues for hours? This time spent increased for how months?
Maybe for last 2 months.
Okay, and previously, how long did it continue?
Uh, in the first episode, it lasted for only few seconds to minutes.
Okay, okay,
After
and yeah, yeah, yeah. Well, can you please tell me that how many episodes do you feel per day, or how frequent are these attacks now?
it has no actual counting. I think maybe sometimes once in a month or twice in a month.
Okay, okay, that's all right. And well, have you ever felt any pounding in the neck?
No,
Okay, any do you have any urge to go for water work in the night?
no.
Okay, and okay, and well, can you tell me that do you have any chest pain?
No.
Okay, and any any shortness of breath that you told? When did it first start? Can you please tell me
Uh,
this shortness of breath?
about 2 months ago, when this palpitation episode lasted for 1 hour at that time.
Okay, and does this? How long can you walk nowadays? Is it present all the time? This shortness of breath, or it comes only when
So
this heartbeat?
I can do my job. It doesn't affect my working. But when I feel the palpitation, at that time I feel shortness of breath.
Okay, that's all right. And do you have to use extra pillows now to sleep comfortably?
No,
Okay. Do you have to, have you noticed any leg swelling?
no.
Okay. Have you noticed any changes in your weight recently?
I think I have lost a few kg weight, but I think that is due to the statin tablet.
Okay. And well, is it intentional or unintentional?
Unintentional, doctor.
Okay. Any weather preferences? Any hot or cold weather preferences?
Sometimes I feel that I am getting somewhat warm and some flashy. So sometimes I usually prefer to be in cold weather. That is a
You
new
prefer cold
parameter.
weather. Okay.
Yes.
Well. For how long have you been feeling like this?
This is for months.
For months.
No,
Okay.
no,
And okay. Do you have you ever measured your blood sugar level during these episodes?
no,
Okay. Do you ever feel any hunger during these episodes?
no,
Excess sweating during these episodes?
no,
Okay. Do you feel that there is occasional headache or occasional flushing of your face during these episodes?
no.
Okay. And do you feel that you are under some extra stress recently, or has it been all the same?
No, I think I am just like before.
Okay, that's all right. And okay, that's all right. And can I ask you some other questions now? You told that you didn't have any headache. Do you have any blooding or any changes in your vision?
No,
Okay, any soreness in your mouth?
no,
Any skin rash?
no,
Any joint pain?
no.
Okay, any raised temperature? Have you felt?
I feel somewhat warm than before, but I cannot tell this
Okay, for
temperature.
how long? Okay, for how long?
A couple of months.
Okay, and have you ever measured your temperature, your body temperature?
No,
Okay, you didn't feel okay. Have you noticed any changes in your nail? Any red spots in your nails?
no,
Okay, any redness in your waterwork?
no,
Okay, and any difficulty in speech or swallowing?
no,
Any weakness in any part of your body?
no,
Okay, any abnormal sensation?
no,
Okay, any tightness of chest or noisy chest?
no.
Okay, any what about your waterwork?
I think it is just like before.
It is just like before. Okay, and your bowel movement?
Bowel movement has increased somewhat. I think sometimes I need to pass my bowel 2 to 3 times a day for last couple of months.
Okay, and how is the bowel movement? Is it more voluminous or normal?
No, I think normal.
Okay, and its content? How is its consistency? Is it hard or soft or semi-solid?
No, just like normal.
Okay, any blood any times?
No, I haven't noticed.
Okay, any mucus?
Somewhat.
Okay, and any relation with food? Have you noticed that anything makes it any food makes it worse or better,
No.
or anything makes it worse? Okay, that's all right. And okay, and you told me that you had an heart attack 1 year back. Well, can you please tell me that uh, what treatment did you get? Did you go to doctor after that heart attack?
Okay, I felt severe chest pain, and after that, I went to the emergency department, and they admitted me, and they told me that I have heart attack, and so they gave me some injection, and after that, on discharge, they gave me some medication, that is aspirin, simvastatin, and also they said, and one thing that was remipril, and another thing was atenolol, and they said that this will prevent further attack in the future.
Okay, and did you undergo any intervention?
Now,
Okay. And well, apart from aspirin, do you know that it is a blood thinning agent? Are you aware of that?
No,
Okay, actually, it thins your blood so that it doesn't clot away. Clot. Okay, and any other medication has been prescribed or just those?
just those.
Okay, and well, can you please tell me that have you been taking this medication? Actually, there are a lot of medications, and it might be difficult at times to take so many medications. Can you please tell me, are you compliant of these medications? Can you take these medications regularly?
Yes, doctor.
Okay, so you are fully compliant with this. Am I right?
Yes.
Okay, and may I know that did you have any other previous health issues, like any problem with your glands or something like that?
No,
Okay, okay, and well, apart from these medications, do you take any other medication?
no,
Okay, allergy to any medication?
no,
Any over-the-counter medication?
no,
I'm sorry to ask, but any recreational medication?
no, never.
Okay, okay, that's very good. And I'm going to ask again some personal questions. Do you smoke?
I smoked previously, but after the heart attack, I do.
Okay, okay. For how many years and how many sticks did you smoke
Uh,
previously?
that was for about 50 years, about 10 sticks per day.
Yeah, yeah. And now you have quitted it.
Yes.
Oh, that's very good. And may I know, do you drink alcohol?
No,
Okay. And may I know that it's actually a personal habit. Do you drink coffee, caffeine?
not much. Maybe one cup,
Okay, well,
1 or 2 cups a day.
okay, okay, that's all right. And may I know what do you do for your living?
2 minutes remaining.
Yeah, what do you do for a living?
I am just living with my children and myself doing nothing, but previously I was a school teacher.
Okay. And are you well supported economically?
Yes, doctor.
Did you okay? And may I know that do you have any family history of such illnesses or
My
any heart
father,
issues?
my father had heart attack when he was
Okay. At which
70s.
sorry, what which age?
70s.
Okay, okay. And any sudden death, history of sudden death in the family?
No,
Okay. And may I know, do you drive?
no.
Okay, that's all right. And may I know what your concerns is?
Why I am having this, doctor? Uh, is it any heart attack or mini heart attack?
Well, actually, at this moment, we have to first examine you properly and then assess you. Then we can get you more precisely. But as long as we have taken our history, I think that you are suffering from a condition that named atrial fibrillation. It's actually occurs when the wiring system of the heart doesn't work properly and there is some irregular heartbeat. Okay, so we are not completely sure about it, but we have to do some blood tests, some electrical tracing, and also some scan of your heart, and we will also involve the heart doctor, and we will at the same time we will also check that whether there is any thyroid issues or not, because some of your symptoms point to that there might be some issues with your one gland named thyroid. Okay, sometimes this gland can get hyperactive, and this can also cause this type of irregular heartbeat and irregular heartbeat. So I think that we will address those issues. And since you are having these episodes for hours now, I think we will keep you under observation until we get your test results, and then we can map out a plan more precisely. Are you getting me?
Okay, doctor.
Any more questions?
Is it curable condition?
Well, at first we will have to diagnose it properly. What's causing it, and then it depends on the cause. At times it can be completely treatable, or at times we cannot treat it completely, but we can prevent the episodes by giving various medications and taking various measures. Are you getting me?
Okay, doctor.
Any more concerns?
No, doctor. Thank you.
Okay, okay. Mm.
Okay. So, what is your diagnosis?
I think my diagnosis will be paroxysmal atrial fibrillation uh, due to heart attack, and also which is precipitated by recent thyrotoxicosis, I think.
Okay. How will you investigate?
Okay, first of all, I will go for some routine blood tests like CBC, VTS, CRP. Then also I will go for heart tracing by doing ECG and 24-hour Holter monitoring. I will go for echocardiography, and also I will go for thyroid function test. And I will also involve the cardiology cardiac specialist to see whether any catheterization or any angiography should be done or not. He will decide upon that.
How will you,
And I will also for chest test. If-
how will you manage that?
Well, since she is over 65 years of age and also has an history of ischemic heart disease, I think I will go for his rate controlling first. Although she gets atenolone, we will review it that is it proper or not, and then we might go for other drugs actually, like some calcium channel blockers also, and uh, digoxin if needed or not. And if and we might also we will consult with the actually heart doctor that whether any rhythm control measure is appropriate here or not by giving her amiodarone or not. But since I think she has some thyroid issues, that would be evaluated at first, because amiodarone can also have problem with thyroid issues.
Do you think this patient needs any anticoagulation?
Yes, of course. I think that along with atrial fibrillation's main treatment, she must have some blood thinning anticoagulation, most probably warfarin.
What are the contraindications for warfarin?
Contraindications for warfarin may be high blood pressure, then labile INR, then also abnormal liver and renal function. That I think that has great score. What we know that this can be this can help us to know about the bleeding chances, and this can be, we have to look into that. I'm not sure about it. I think.
Okay. Thank you.
Okay, doctor.
For this, your history taking was fine. Just when talking to the patient, just add some misses or mister before name, because just calling by name somewhat seems awkward.
Okay, I should call me Mr. or Mrs. Is it
Yes,
right? I
yes,
am have a
yes.
confusion about.
Yes,
Okay, okay.
please.
Yes. Okay, that's all right. I had actually confusion about it. I didn't know it properly. Okay.
Okay, and after that, when talking to the patients, avoid the jargon, and when talking to the examiner, always use the jargon. You are using heart doctor with the examiner.
Oh, sorry.
History taking was
Yeah.
fine, except for those that contraindication for anticoagulation is needed or not. Like, do you have any history of a stroke or any weakness in the past? Any
I think I asked those.
weakness? You just ask about weakness present. We have you had any history of
Mm-hmm.
in the past? Any jaundice in the past? Any problem with your kidney? Do you know anything about that?
Mm-hmm.
Have you
Mm-hmm.
ever vomited out blood?
Mm-hmm.
Have you
Mm-hmm.
noticed any blood stool or black in the stool?
Mm-hmm. Okay.
And family history, okay, you have went those well. That's
And
okay.
what was the diagnosis here actually?
So this is a case of atrial fibrillation. For the atrial fibrillation, the underlying causes could be from thyrotoxicosis, from previous myocardial infarction, and you haven't asked about any recent history of fever, that or any chest infection.
Mm-hmm. I actually asked at that time. Actually, I didn't ask recent. That's also a problem.
Overall,
No,
this
I
is
actually didn't ask. No. I actually didn't ask. I remember now. Okay.
And alcohol is another issue, and idiopathic is always the issue, but alcohol, she is not taking much alcohol. So
Yeah.
not a case in her.
Yeah. Okay, so I think that's all. And about the management, was it right?
Yes, management is right. Just involvement of cardiologist, and after that some medical management, and medical management should be optimization her drugs for myocardial infarction, and after that finding of underlying causes, and according to it, management of thyroid issue,
Yeah.
and for
Yeah.
atrial fibrillation, going for assessing for anticoagulation.
Yeah. Okay. Okay, that's right. Okay, and I think that's all.
Another issue that patients lives alone or home.
Yeah.
She live
I
with
think
some
I forgot.
patient needs extra care with atrial fibrillation. She may develop some again develop a stroke. So she needs some extra care.
Okay. Okay.
And